And now, please welcome to the stage actress, environmentalist, and longtime Emma board member, Wendie Malick.
Well, hello again. God, this is my 7th summit. And wow, has our world ever changed? Back in 2017, we were all concerned about global warming. And now we're digging out our winter coats and rain boots and wondering if we'll ever get back to any kind of normal. This has been the coldest California winter since 1978. All over the Earth, climate instability has caused storms, floods, and earthquakes on a biblical scale, and record temperatures both high and low. These extremes have left us all wondering what tomorrow has in store. The sneaky secret is that this is not a rapture, rather a man-made climate disease created by. There's no ducking it. Pollution and the destruction of essential environmental resources is on us humans. And not only is it causing us to feel unusually schizophrenic, it's causing severe health issues for many of us. Can you not hear me? For many of us and for our loved ones. And all this begs the question, what the hell is up with our climate and how is it affecting our health? Well, what better way to answer these questions than with our climate health doctor, Elizabeth Auld, an activist and Emma board member, Nalleli, Cobo. Welcome, ladies.
Thank you.
Who just came back from Egypt and COP. Very exciting. Lizzie, can you explain the Climate and Health Policy Fellowship Program that you're currently part of that was founded and is directed by our fellow Emma board member, Dr. Jay Lemery?
Yeah, absolutely. So I think I'm a stand-in for Jay this year. Sorry that he's not here to join us, but I'm thrilled to be here myself. So Jay, in 2017, founded Climate and Health Policy Fellowship. It's based out of the University of Colorado. And the purpose of the fellowship is to train physicians to be climate advocates, educators, and really to be, advocates for our patients in the face of climate-related health disasters. So the fellowship has grown to about 5 doctors. It's a graduate medical education fellowship, so it's made for people who are medical doctors that have already finished fellowship. This year we have fellows that range from specialties from emergency medicine, such as myself. We have a neurologist, we have a neurosurgeon, and an internal medicine doctor. And really the hallmark of the fellowship is they pair us with governmental agencies as well as NGOs that work in the climate and health sector. So the governmental agencies we work with range from FEMA, NOAA, the USGCRP, the new HHS office called OCHI, which is Office of Climate Change and Health Equity. I'm personally paired with the CDC in their climate and health program. And really the purpose is, as I was saying, to create doctors that are able to speak about the issues of climate and how it affects our patients. Graduates of our program have gone on to be advocates, leaders in health education, as well as leaders in the healthcare sector, decarbonization.
So was this something that had not been really addressed before, like connecting the dots between what the medical world is doing and the environmental issues that we're facing?
Absolutely. So it's, I think the links between climate and health have been well known. It tends to fall more in the public health realm. And so Jay's whole purpose is let's bring doctors to the conversation. We're the ones that are taking care of patients. We're the ones that are seeing some of these issues in real time. And so our stories and our perspective on it can be fairly powerful. So it's the first of its kind. It's actually the only of its kind in the country. So.
Bravo.
Yeah.
Nalleli, you are a living example of someone who has suffered from environmental toxins. Can you tell us a bit about the harrowing experience that you had and how it affected your health and the health of your community?
Yeah, of course. First of all, I'm very honored to be on stage with both of you. This is a pinch me moment. But in my
no, we're not Justin Bieber.
Yeah.
Yeah, I love. If anyone knows
It's
Justin
a huge
Bieber,
boy crush.
I'm being exposed. In my personal experience, at the age of 9, I started getting really sick. I grew up in South LA between Staples Center and USC, and all of a sudden, I went from being a healthy girl to a girl that always had nosebleeds. My nosebleeds got so intense, I couldn't sleep in my own bed. I had to sleep in a chair to prevent choking on my own blood at night. I developed asthma. That's something I'm always gonna live with now. Heart palpitations that got to the point at the age of 9 and 10 that I had to use a heart monitor for several weeks. Headaches, body spasms that got so intense I couldn't walk. My mom would have to carry me from point A to point B. At the age of 19, I was diagnosed with stage 2 reproductive cancer, and I fight because I want my story to end with me. I became an activist at the age of 9 out of survival. I didn't wake up one day and say, this is the day I become an activist. It was, I woke up one day and I said, I want to be able to open the windows in my own home and not get sick. I want to be able to play outside the way you see it on Disney Channel growing up. I wanted that normal childhood. And I had my childhood robbed of me because of my zip code, because of our socioeconomic status. Growing up 30 feet from an active oil and gas well changes everything. It's not your typical neighbor. It's not the neighbor that wakes up at 5 a.m. mowing the lawn and you're like, oh my goodness, like this is the one day I got to sleep in. It's a neighbor that's killing you, a toxic silent killer. And it's also affecting our safety. Something people don't often know is that these wells operate under such immense pressure that every 10 to 15 minutes they have to open valves to prevent an explosion.
Amazing. And being someone who has actually lived through this and survived it, you are a really powerful speaker for this problem. How have you been able to help other neighborhoods that are going through the same thing?
So I am a proud co-founder of People Not Bolsos, which is a grassroots campaign in my community, People Not Wells. And together we fought tirelessly to shut down that well. And after 4 years of us advocating in what felt like silence, we caught the attention of the Los Angeles Times. They wrote an article about my community, and that story captured the attention of former U.S. Senator Barbara Boxer. She came out and had a press conference with us, and she pleaded Auld to cease operations. She also brought U.S. Environmental Protection Agency officials in to conduct an investigation inside of the well. Within 5 minutes of being inside, they had to evacuate because they got sick. Wow. 5 minutes, that's all it took. Imagine us being exposed 24/7, years on end. And recently, we had a historic victory where the Los Angeles City Council and I tear up every time I say this, the County Board of Supervisors voted unanimously to phase out all oil and gas wells in the city and ban new oil exploration, making it a historic change that was possible because of a frontline community that was viewed as invisible, as disposable, and we said we are not that. We decided to raise our fists in the air and demand our basic human right of breathing clean air in our homes. And the oil well I grew up 30 feet from is actually permanently closed as of March 2020, and it's the first oil well to be permanently shut down in the nation.
And it's amazing, amazing. And another reminder that people who don't have a voice need leaders who are courageous enough to get out there and put themselves on the line like you did, and then call in people that have this kind of power and influence that Barbara Boxer had to bring attention to it. I miss Barbara Boxer, but that's an aside. Lizzie, you're a new mom. How has that changed the way you approach this problem and the way you look at climate health? Was that part of the reason that you joined this fellowship?
You know, so my path towards this has been ongoing since I was in college when I was an environmental science major, and I've been trying to figure out a way to combine my interest in human health and environmental health for a while, which is why Jay's fellowship was the perfect thing for me. So I would be lying if I said it was my motivation to get into this work, but I certainly, it certainly adds some added pressure and perspective. You know, I want to make the point that children are not just small adults. So children have developing immune systems. They have developing organs. It's actually interesting. Children breathe more breaths per minute than adults do. They also eat more food for their body weight than adults do. So their exposure to toxins and environmental pollutants are greater than that of adults. And the impact of environmental degradation, I mean, and unfortunately, I mean, and even we're seeing from Nalleli's story, it can be devastating. There's some statistics that are out that children born today are going to experience 3 times as many climate-related disasters than their grandparents. So what that really means, and I'll give a couple specifics. So we're looking at increases in heat waves, which is, a known fact. 10 of the hottest years have been in the last 15 years. So we're seeing hotter years. Little kids, babies, infants have no ability to regulate their temperatures. So in households that lack any form of air conditioning, this can be deadly. We're seeing increases in air pollution, and what that means for kids can be pretty significant on their health. So a couple specifics: increases in wildfires, which unfortunately here in California, and I live in Seattle, we're all too familiar with. So that leads to increases in air pollution, which is a major respiratory irritant. We're seeing increases in allergens, so longer growing periods of plants that create pollen that kids are allergic to, worsening asthma. We're seeing increases in ozone from combustion of carbon that also has been known to be a big, hugely detrimental on the developing lungs of children. Another thing we're seeing is changes in disease vectors, which affects children and adults, but I'll just give a couple examples of things that we're seeing. So the tick that carries Lyme's disease is now able to, usually it was in the Northeast in a pretty specific area, and now it's trending all the way up into Canada, and we're seeing it expanding its footprint, which is causing huge epidemics and outbreaks of Lyme's disease in places that they've never seen before. Mosquitoes that carry dengue and malaria are now able to survive in regions of the world that they've never been able to survive in. We're seeing things like, mold exposure from, torrential downpours, like these atmospheric rivers that we're getting here in California are causing damages to homes that then, once dried, are causing increase in mold exposure, which is really can be extremely detrimental to kids as they're growing up. And then the other thing I just want to mention is the mental health impacts of climate-related disasters on kids, and just climate change in general and environmental degradation and that impact on mental health. So kids go through a tremendous amount of trauma when they are faced with a climate disaster. They lose their homes, they're uprooted from their social systems, their schools they're taken away from their schools and their education system. And we've seen that this can lead to high rates of anxiety and PTSD. And then there's kind of just the underlying issue of the fact that kids are growing up with this very known reality that they're going to be living in a world that is getting hotter and more dangerous, and that is in and of itself leading to worsening anxiety in our younger kids. So, I think we can all agree that every child deserves the chance to live a healthy life. And honestly, what we're seeing is with environmental degradation, kids are particularly vulnerable. So again, having a child gives me added fuel to this fire, but I think that we all can agree that they should be, that protecting our children should be our number one priority.
Yeah. No, and I have a 21-year-old daughter, and I know that she and her friends all are dealing with this pretty constantly, and it does cause incredible anxiety, and rightly so, which is, one of my favorite phrases is Bernie Sanders had a quote, "Despair is not an option." And we were sitting at breakfast this morning, and I was talking to some of our young activist participants here. And that is so important to understand just how deep and immense this problem is, but also to realize that the only way to approach it is to find solutions. And it may be baby steps for a while, but anytime we can move the needle forward in trying to make this a more equitable planet and to listen to all of the people, because so many times we offer solutions that are available only to the people who can afford them.
Yeah.
And it has to go far beyond that for us to really make a difference and do the right thing. Nalleli, you've already won the Goldman Prize. You're an active member of the Emma Activist Board. How does this recognition impact your future plans?
Well, my plan still remains to run for president in 2036, so...
Marry Justin Bieber. Sorry, she just told us he was her first crush, and so we're giving her a lot of grief.
I feel so exposed. It's definitely added a sense of responsibility and that reignition of that fire and passion in our bellies of why we're fighting that. I fight to end urban oil extraction. I fight to end environmental racism. Like I said earlier, I fight to end, so my story ends with me. I believe everyone has the right to breathe clean air no matter their age, their gender, ethnicity, socioeconomic status, or zip code. And when I think of the future, I dream of a world where kids, they learn what urban oil extraction is when they read a history book. They look outside of their windows and they see trees and not an oil rig. And by having the Goldman Environmental Prize and serving very proudly on the Emma Activist Board, it reignites that fire and that platform to continue our work and further our dedication for this, because we won't stop people always say, as long as I'm willing and able. And I'm always willing. So as long as I'm able, I'm going to continue to be a voice for my community and to end so many environmental injustices in our world.
Do you think you'll run for office?
Yeah, president, and then somewhere else along the line, but I'm shooting big.
Well, maybe start with Congress. I don't know, just a thought.
Yeah, maybe.
You have my vote.
Thank you, thank you.
Lizzie, you're a board-certified emergency medicine physician. Can you explain a little more how that work with the climate fellow, as a climate fellow, is relevant to the work you do as a physician? Can you just
Absolutely.
connect that a little more?
Yeah, it's funny because I get asked often how are these two related, and so I'll try to explain what I'm seeing and why I think it is relevant. So as an emergency medicine physician, I get trained in managing disasters, triaging, and also to treat acute illnesses. I'm just going to give a couple examples of where and why and how I see climate kind of interacting in the intersection between climate and emergency medicine. So this last October 2022, I live and work in Seattle, if I didn't say that before. But the Pacific Northwest saw the worst air quality index, so the worst AQI in the entire world, and it was for about a week due to wildfires in the surrounding areas. So what that looked like was, and many of you, unfortunately, here in California probably have dealt with wildfires and the effects of the toxic smoke that comes from that. But you go outside, the air is thick, your eyes are burning, your lungs are burning, your throat hurts within 30 seconds. It's brutal. But what I see in the ER in the coming days are people coming in respiratory distress and respiratory failure, requiring admission to the hospital because they're having massive, impacts from this smoke. So that's one example. Another example are heat waves and heat-related illness. So back in June of 2021, bringing it back to the Pacific Northwest, because that's my reality right now. There was a massive heat spike there with temperatures soaring above 112 degrees for about a week on end, about 10 days. To put that in perspective, and I'm not sure what air conditioning access is here in California, but 47% of the households in the county that I live in Seattle, have no form of air conditioning. That means no mobile units, no mini splits, no central air. And people are living in temperatures greater than 100 degrees inside their homes. We know that that exposure to heat waves increases cardiovascular disease, it increases renal failure. For any patient with diabetes type 1 or type 2, they have 17% increased risk of death in heat waves than somebody without diabetes. But so the death, morbidity, and mortality that we see related to heat waves is proven, it's known, it's seen, and we see it in the ER and subsequently in the hospital, unfortunately. The one kind of other example that I want to bring up that I think is particularly relevant and continues to be more relevant is just healthcare infrastructure. So I just finished residency a couple years ago, but I trained at NYU and Bellevue in New York City. This was before my time, but in 2010, Superstorm Sandy hit New York City, flooding all the way up through First Avenue. Bellevue Hospital, very briefly, I'm very proud of Bellevue Hospital, but it is the oldest public hospital in the country. It was built in 1700s. It's actually what First Avenue was built as a road from the Wall Street area to Bellevue Hospital. But it has been open and is a offers critical services to Lower Manhattan. It's the only trauma center in Lower Manhattan, and it services about 5 million people daily who come into the city for work. The hospital flooded, and they had to shut their doors for for several weeks, if not a little over a month. They had to evacuate close to 800 patients who were critically ill that were hospitalized at the time. And so the devastating impacts of climate change not only affect the individuals, but we're seeing in climate disasters, it's impacting healthcare infrastructure, which the ripple effect from that is tremendous, because you lose access, and the effect on communities is very widely felt, and the magnitude of it can be devastating. So anyways, my point is to say, I think as a doctor, I get to see, unfortunately, the impacts of climate on human health. And so again, my goal is just to shed light on this and to be an advocate for my patients. I just want to bring up one more thing that I haven't said, which I think is extremely relevant, but climate change is not an equal opportunity player. It does not affect everybody the same. When speaking about these heat waves, again, the people that don't have air conditioning are the ones that are going to be affected, and those are most likely going to be our low-income communities. We've seen, redlined neighborhoods have, on average, they're 5 degrees hotter on summer days than non-redlined communities. So in our increasingly warming climate, we know that there are health impacts of heat, but this is directly impacting our low-income communities, our redlined, our previously, our already segregated and disenfranchised and disadvantaged populations. And so I think we need to have that as kind of the first and foremost, the beginning of the conversation when we're talking about this.
And that goes back to people who can afford and have options. I remember during the pandemic how many people left cities and went off to other houses in the country because they could afford to, and were able to sort of avoid the hardest hit areas that were getting clobbered by the pandemic. And the same thing happens with climate change. When it gets too hot, there are people who have the option of getting out of Dodge before it gets too gnarly. And that, of course, is not the case for most people on the planet. Nalleli, what would you like to see change in our healthcare system so that at-risk communities have better access to healthcare?
As someone who was misdiagnosed for 5 years, I think it's extremely important we listen to patients. I had been going to the doctor since I was 14 because I knew something was wrong with my body. But for 5 years, I was silenced, I was ignored, I was gaslighted. I was told the odds of you having something are 1 in a million. Fast forward to the age of 19, it was stage 2 cancer, and my medical case turned out to be 1 in a billion. I should start buying lottery tickets at this point, because that luck is just, the reality is that some amazing doctors like Dr. Lizzie here are listening to us, but so many others are not. And you can't help but think if you had better health insurance, if you had a different name, if so many other different things were at play, if you would have been diagnosed sooner. If I wouldn't have been turned away, if I wouldn't have been told the millions of horror doctor stories I have. Those experiences would not be here with me if I had a better health insurance, if I had a different name, if I had so many other different things. But that's, like you said, that's not the reality for so many of us. So I think it's extremely important that as patients we advocate for ourselves, we know our rights, because I would ask for exams and they would say there's no need for that, but I wish I would have known, if you're not going to give me the test, please put it in writing that you're denying me said exam. And 99% of the time they will be afraid and give you said exam, because you have the right to ask for those things. You have the right to be treated properly. You have the right to be properly examined and heard. And changing the medical system in that sense is critical to saving lives.
And also that we are so poor in this country at doing preventative medicine. So many times we wait until people are really, really sick and go to the emergency room, and it ends up costing so much more than it would to actually give proper health care and testing and exams to the country and stop it from getting out of hand in the first place.
I can't help but think if I was properly examined, if I was listened to, I think I wouldn't have had the cancer develop that far, because cancer does not grow overnight. This is a 5-year span, and I was gradually getting worse. And unfortunately, I lost the ability to bear children, which was a dream of mine, and I can't help but think, again, those decisions would still be mine to make. before I lost them at the age of 19, before I could even make those decisions for myself.
All right, this last question is for both of you. What do you think is the role of communication in the media in educating the public about the dangers of environmental health risks? How can we help?
I can.
You want to go? Yeah.
I think education is the first step. We need to learn what is wrong in order to create change. We need to learn what is a possible solution to create change. I think social media and media is an extremely powerful way to share our stories, to reach audiences that we possibly could not reach because it's an international. You can reach someone across the world in a matter of seconds. I think that's an extremely powerful tool, and we need to use it to our advantage to share our stories, to share our truths. No matter how raw our stories may be, if we lived them, other people can hear them. And I think that's critical to this movement is storytelling. I believe storytelling is a very compelling form of activism that often goes unnoticed, and I'm trying to bring it back. I think the media has an important part to play, and we need to work together as a team, allowing us the platform to share our stories, allowing us the space, a safe space, to share our stories and to be heard, and to allow us to share our stories and not somebody else, because nobody knows our stories better than us. Nobody knows our truths better than us, and we should be the ones who run with our stories, but we do need that collaborative team effort. We need that intersectionality and to work as a family, because at the end of the day, all of our lives are on the line. And if we work together as a team, I think of it as a symphony. You know, we're all a symphony, and no matter what instrument you're playing, a small one like the flute or a big one like the bassoon, you're instrumental to solving the climate crisis. You have such a unique and important part to play with your tools, your skills, your advantages and disadvantages, because your advantage might be my disadvantage and vice versa. And together we have all of the tools, because I know I don't know all of the legal terms or scientific terms, but working with a lawyer and a scientist and a doctor, we're unstoppable.
I love the orchestra. Love that.
You know, I'll piggyback on the back of that. I think we each have our own spheres of influence that we are experts in. You know, you don't have to, what I've recognized this year, you don't have to be a client scientist. You don't have to be an expert. There are so many unknowns. We don't know what's going to happen, but just kind of leaning into it and recognizing that we all have a voice, we all have a story to tell. My personal goal is to be an advocate for patients in the communities that I work in, but I think that each and every one of us who are here today have our own skill set and, again, our own spheres of influence, and we have to lean into that. It's scary to talk about these topics, especially if you don't feel like you're the expert on them, but I think the more conversations that we all have, the more light that we shed on the issue, we will all come together and find some common ground. So,
I think Gloria Steinem once said, I was at an event where we were working with Planned Parenthood and going door to door in Miami, but she had this wonderful, I said one night, God, when I grow up, I'd really like to be more like you. And she said, don't ever say that, because we need all the voices at the table. And I think that's what we're talking about here, is everybody has something to bring to this problem. And you find out what your strength is, and then you collaborate with others who have different strengths, and suddenly you can make stuff happen. Yeah. So thank you both so much for being here, and
you.
thank you all for coming.